health sciences, and I have this new startup company, a community interest company, with my co-founder here, Paul Jewett. So there's our new logo. And the company is really to scale up and roll out this system called Keep On, Keep Up, which is a gamified healthy ageing and falls prevention system I'll tell you all about. The problem really is it's something that for about 10 years when I worked in the NHS, I was called into A&E at least twice a week to see patients with traumatic fractures. I'm sure falls are something that you must all be aware of, a relative or something that's suffered a fall. And it's kind of the start of a downward spiral of deterioration. And fear of falling, it's one of the greatest fears actually as you get older. So you can see some figures here. 30% of over 65-year-olds fall every year, and that just increases as people age. And they are very costly, not just to the individual, like I've said, but also to the NHS. 2.3 billion, that was in 2013, so it's actually much greater now. And in the US, 50 billion, and of course in the US, also left, right and centre, people fall. The better news, though, is that we've done, well, not just myself, but a huge team of people, and before the work we started doing in around 2001 was in this how to prevent falls, all these interventions and things, as well as the epidemiology. And we know from hundreds of randomised controlled trials that exercise, particularly strength and balance exercise, is particularly efficacious. So you can see over here, 159 trials, 80,000 people, basically multiple component exercise or home-based or group-based exercise can reduce falls by at least 35%, going up to 50%. So you can imagine there's a lot of room there to improve this area. However, having all this knowledge is great, but the issue again is about implementation, get it into practice. And if any of you have had to try and get hold of a physio, there's long waiting lists. And for older people, they can get out, they have transport problems. If the weather's not so good, they don't like to go out if it's raining or icy and so on. So we decided to try and bring all of this information and get it into something that was more accessible, that was affordable, that we could easily scale up, and that's where the system we started to develop. And my colleague Paul and I were both interested in gamification, which isn't just gaming, there's a little bit of that in there for older people, but it's all the kind of game elements, rewards and points and so on, to get people to adhere to these exercises, which, to be fair, not many people want to do. So everything you see within the system, it is based on evidence, and we've worked with older people, and that's why we've got these colourful, friendly characters who want perfect gym instructors or avatars, or even older people themselves, or seeing older people in videos. And we've got the strength and balance exercises, we've got things like hydration or bone health games that they can learn about the things that nobody really wants to read about, but it's much more engaging playing a game. And we've got things in there, so progression is built in, which is really important, and there are descriptors in there. So I would normally assess a person, I'd look at their gait, I'd look at their balance. It would take me quite a long time. But this system, it's completely self-manageable, so there's no need for a clinician, because the person picks what level, what description best suits them, and then there's a tailored exercise program that they can use wherever they want. It's a partnership, so between the University of Manchester and Reason Digital have done all the programming behind this. They're a creative agency and a tech for good company in Greater Manchester. And Jigsaw Housing Group are a large social housing provider who we've been working with so we can access large groups of older people. Here's the team, you might recognise a few faces. Tony, who's our chairman, and we've got Ed Cox, who's our CTO from Reason Digital, and then we've got a couple of business advisors to help us with this next stage of trying to scale up. Funding-wise, I think we've been working on this for about 2.5 years now, so we've gained funding from Greater Manchester Academic Health Science Network, ESRC, Health Innovation Manchester, and the Innovation Fund Denmark. So we've raised 265,000 there. And as Tony mentioned, we recently submitted to Innovate UK for their ring-fenced iCure programme funding, where hopefully we might be able to gain 70% funding if we can find 30% match. If anyone would like to help us with that. So we should find it any day. And like Andrew, I just want to extend a big thank you really to the Innovation Optimiser team, because without them I certainly wouldn't be, or we wouldn't be at this position now. Because we've attended the various training, Roadmap and Momentum, which are fantastic, but also we've had very much tailored support. And it's like they know what the hurdles are going to be before we hit them and prepare us for them, which, you know, it's worth its weight in gold, really, than that support. And we certainly wouldn't have known about the iCure programme, which again Tony's mentioned briefly, which we applied for and gained and started in January, and it enabled me to do this amazing customer validation journey. So I was able to go to Tokyo, where they've got a huge problem in Japan with the ageing population, and look at the technologies and things they're using there. Went over to the US, went to MIT and Harvard, and various trade shows, and saw their issues, which at first I thought they'd cracked all these problems, but actually, you know, they're in a worse state than we are, and their systems aren't linked in and they're very fragmented. We had some really good news because in Texas, where we've got this huge medical centre of 134 hospitals and institutions all together, they want to license and start using this system. So that was, again, really worthwhile doing. And then we've linked in with collaborators and charities and regulators and learnt all this, I guess, new language, but also this feedback, which we wouldn't have been able to do in such a rapid amount of time. So as you can imagine, the people that might use this system will be older people themselves, but it's also people like us with parents who we're getting concerned about, who are ageing, and, you know, we want to help. So things like, you know, finding out, I call them adult children, but they're the people who want the peace of mind, really, that, oh yeah, my mum's falling, she could use this. And then there's all the different institutions, so we've met with various representatives from CCGs and primary care and care homes, assisted living facilities in the private and public sector, and got feedback from them. And we found out, you know, on the wards there are lots of patients who are sat, they're medically fit, they're looking to go home, but there's no social care, and so they start to decondition and deteriorate and so on. So we've had people asking for it, you know, in all different areas. And then in the insurance companies, I said, in America, if someone falls, straight away they sue. They sued for about 20,000 and they settled for about 2,000. And we're starting to see that over here because people are seeing that, yeah, there's evidence that we can prevent falls. So insurance companies are very interested in what we're doing, as well as charities and platform providers are looking to add value to what they're producing. So through iCure as well, we learned about this, the different routes to market and how can we scale this up rapidly. We're looking at just starting to do this now with a web-based application that can be compatible with any system really, or interface, so tablets, mobiles, PCs. We found that, you know, you could perhaps put this on social prescribing lists, the NHS rehab and innovation tariffs, Medicare lists. So instead of looking just at Manchester and how we can roll it out here, we've looked much wider because of the support and people around us. So the next steps, and this is where, again, obviously we're waiting any day, we want to get this next bit of funding, we want to use some of the feedback that we've got to extend the system further, so embed some further measurements in there, and data analytics and behaviour analytics and things, further personalise it, and then commercialise it and really try to start to scale it up and generate revenue. And we're just going through lots of regulatory approvals with NHS Digital that's coming to an end as well. And then research-wise, which is, you know, our comfortable backgrounds, we're just finishing a usability and acceptability trial in Manchester with 100 people, or in Nottingham as well. We're starting a trial in Texas because of the links that we've got through iCure, and we're part of a study, a much larger study in Copenhagen, where we're looking again to roll this out with 200 users. So I think we could say we're rapidly gaining momentum like the name of the programme. So our ask is, first of all, would anybody here be willing to buy this? If you would raise your hand. Yeah? Yeah. Great. Okay, and how much would you be willing to pay? If this was for, say, a family member who you think, yeah, they really benefit from this, how much would you pay? Because that's really hard for us to kind of price. So,
so would it be a one-time purchase or some sort of subscription model?
A one-off.
One-off.
I pay £125.
£125?
I was going to say about 20.
20?
30.
Any less, any more?
I think a subscription model would be stronger because you could give feedback as well, and you could use collaborative data.
Yeah, so freemium and then premium and things like that. But I think getting that first gauge of what people will pay, because there are apps out there that are free, there's the £1.50, there's the £3, you know, and so on. It's just good to get as much feedback as possible. So.
Data.
But I'll take 125. And then really, anyone that would like to help us launch this to scale it up, you know, we're very welcome from just support to test it with family members or invest, very welcome. So yeah, these are our contact details. Thank you.